Welcome back, everyone, to the Evidence-Based Hair Podcast. I'm dermatologist and hair loss specialist Dr. Jeff Donovan. I'm also the director of the Donovan Hair Academy. The Academy educates the public about hair loss, and we have training programs for hair loss practitioners as well. Hair loss affects all people around the world, and so we welcome all people to our programs. The Donovan Hair Academy runs the EBHF, or the Evidence-Based Hair Fellowship. The EBHF is the world's most comprehensive training program for hair loss specialists. Our EBHF graduates ultimately complete 2 years of very intensive training and are some of the best trained specialists in the world. The podcast that you're listening to right now is the official podcast of the Donovan Hair Academy. In this podcast, I review studies that are changing how we think about hair loss. I'll introduce them to you, help you make sense of them, and give you my thoughts on how a given study just might change how we diagnose or treat hair loss. And as a reminder, the podcast is for educational purposes and shouldn't be considered a substitute for medical advice. I very much enjoy offering the Evidence-Based Hair Podcast. I enjoy being able to join you for our public webinars throughout the year and our ever-popular Question of the Week program. But before we begin today's podcast, I'd like to add that your support really makes a difference. And I thank all those who have supported us over the years. We have some very big goals for the next 10 and 20 years, not only in our podcasts and our webinars and our Question of the Week program and our training programs for healthcare practitioners, but in our multiple tireless efforts to ensure that the principles of evidence-based medicine will always be our guide in this most perplexing and complicated world of hair loss. If you'd like to learn more about our programs and projects that we're currently fundraising for, or to make a donation, please visit the Donovan Hair Academy at donovanhairacademy.com/projects. And now on to our podcast. On today's episode, we're talking about a very interesting study from the Brazilian Annals of Dermatology, October 2024, titled Dermoscopy of Neoplastic Alopecia Secondary to Cutaneous Metastases from Breast Carcinoma. I really liked this study. It gives us some valuable information about the trichoscopic appearance of metastatic breast cancers to the scalp. Metastatic breast cancer, or alopecia neoplastica, when it infiltrates the scalp, can cause a scarring type hair loss, and it can cause patches of hair loss that very much resemble alopecia areata, but it's more red and it's more firm. Alopecia neoplastica is a type of hair loss that is due to a neoplastic process affecting the scalp. Alopecia meaning hair loss, neoplastica meaning neoplastic cells infiltrating the scalp. And alopecia neoplastica is divided into primary and secondary forms. Primary forms is when the origin of the neoplastic cells is the scalp, and secondary alopecia neoplastica is from metastatic neoplasms. And so if you have a basal cell carcinoma on the scalp, it ultimately causes hair loss. That would be an example of primary alopecia neoplastica. And there's many types of primary alopecia neoplastica: angiosarcomas, hemangioendotheliomas, Paget's disease, etc., etc. Amelanotic melanoma, desmoplastic melanoma. They can be benign or malignant. Secondary alopecia neoplastica includes entities like breast cancer, lung cancer, kidney cancers, and cancers of the gastrointestinal tract. There are certainly many gaps in our knowledge in the trichoscopy of alopecia neoplastica, especially alopecia neoplastica secondary to breast cancer. And it's really important to understand the trichoscopy of alopecia neoplastica, because sometimes it can be the very first sign of a malignancy. Sometimes the very first sign of metastatic breast cancer is a patch of red, scarring-like alopecia on the scalp that looks like alopecia areata, but it's more red and more firm. And so the authors in this study set out to study the trichoscopic features of alopecia neoplastica from breast cancer. And I really like this study. The trichoscopic images are very, very nice, and there's very important lessons that can be learned from this paper, and it's available free online. So the authors here present a clinical case involving a patient with alopecia neoplastica linked to breast cancer metastases. Trichoscopic examination showed specific patterns in the alopecia lesions, and we'll talk about these in a minute. The patient was a 68-year-old woman who presented with a 4-month history of asymptomatic hair loss. An examination showed that she had 3 rounded, circumscribed, smooth areas that were red, and they were hardened on palpation, and they lacked hair. Very typical of alopecia neoplastica from breast cancer. Round patches that are red and firm. 6 years prior to this hair loss, the patient was diagnosed with breast cancer, and she went through mastectomy followed by adjuvant chemotherapy and radiotherapy, and she was treated with tamoxifen and anastrozole. And just 2 months prior to the appearance of these alopecic lesions, the doctors found lymph node metastases from the breast cancer in the left supraclavicular area. And so I'd encourage you to check out this paper in the Brazilian Annals of Dermatology. You can type in Dermoscopy of neoplastic alopecia secondary to cutaneous metastases from breast carcinoma. We'll, of course, put this paper in the show notes. But you can see in this paper the round areas that at first glance very much appear like alopecia areata. They're more red than alopecia areata. And what you can appreciate in these images is you can see blood vessels on the surface of these lesions. And we'll come to recognize in 1 minute that the trichoscopic findings of blood vessels is very important to the trichoscopy of breast cancer metastases causing alopecia neoplastica. And when I think of the trichoscopic appearance of breast cancer metastases, I think of the letter B and C for breast cancer, and I think of the B reminding me of blood vessels and C reminding me of color, because it's the blood vessel patterns and the color of these lesions that is very important. And so if that helps you in the evaluation of the trichoscopic appearance of breast cancer metastases, think of the letter B and C for breast cancer and blood vessels and color. The blood vessel pattern that these authors share is arboriform vessels, meaning they fan out like trees, and fine telangiectasias, so very fine blood vessels that spread out like trees. And the color is multiple colors. Orange amorphous areas was one color, yellow dots, shiny white areas, and milky red areas. So multiple colors in this lesions, not only red, but orange and white. And the trichoscopic images presented in this paper are very nice. You see a red circular lesion on the scalp. This patient had 3. And on the surface are these blood vessels. Fine telangiectasias, so fine, delicate blood vessels, but also these blood vessels that fan out more widely. And the color, yellow dots, similar to the yellow dots you might see in alopecia areata. A red color, an orange color, and milky white areas as well. And the authors also present some very nice histology in this particular paper, showing these atypical epithelial cells infiltrating the dermis in cords with the formation of glandular lumens. So a very typical appearance of these breast cancer cells working their way through the collagen bundles of the dermis. And so do check out this paper, available free online. Nice trichoscopic images, nice histological images, and I thank the authors very much for this very nice paper. And all in all, the authors conclude that trichoscopy serves as a very useful tool in recognizing alopecia neoplastica. And this can be very important sometimes because early intervention can sometimes improve patient outcomes. The ability to recognize that this isn't a patch of alopecia areata, this is a patch of alopecia neoplastica, can help to identify the origin of the tumor. For example, if you biopsy this and you realize these are breast cancer cells in the scalp, you can identify that this is metastatic breast cancer and help the patient connect with interventions which can help with the treatment of metastatic breast cancer. So it can be very, very important. The authors remind us in this study that one of the most common clinical presentations of metastatic breast cancer is this scarring alopecia. And so you'll see this red circular areas often of hair loss on the scalp that's firm. And they're often located in the frontal area and the parietal area. And one of the most common cancers associated with alopecia neoplastica is breast cancer. And there's other ones as well, like gastrointestinal, kidney, lung. But breast cancer is one of the more common ones. And so further studies are certainly needed to understand the trichoscopy of alopecia neoplastica, but this is a really important study. It really highlights the blood vessels and the color change in alopecia neoplastica from breast cancer. Next week, we're back talking about a very interesting side effect, central serous chorioretinopathy. And I look forward to reviewing that paper with you, published in JAD Case Reports, a very uncommon side effect from topical steroids, steroid injections, and oral steroids, but one we need to know about. So I'll look forward to reviewing that next week. Thank you so much for joining me for today's podcast. It's my belief that education and educational endeavors like this podcast can help clinicians acquire new knowledge, which can ultimately help patients. And education can also help hair loss researchers to ask better research questions. And better research questions can give clear answers about how to best diagnose or how to best treat hair loss. And ultimately, this will see benefit in our patients with hair loss. And education can also empower patients to acquire new knowledge so that they can engage in critical discussions with their hair loss practitioners, which hopefully will lead to improved care. At the Academy, we're really proud to be able to offer educational programs for clinicians, as well as educational programs for the public. And if you're a practitioner interested in studying hair loss at an advanced level, you might consider applying to the Evidence-Based Hair Fellowship, or EBHF. This is an intense program, but it's a program that equips you with the necessary skills to really help patients. Our next iteration starts January 2026, and we'd love to have you in the program. You can learn more about the EBHF by contacting our administrators at info@donovanhairacademy.com. That's it for this week. I look forward to seeing you next week for another episode of the Evidence-Based Hair Podcast. Thanks so much.